It is college football time. Did you see last week that Alabama head coach Nick Saban, he tested positive for COVID on Wednesday, and then he had 5 tests, and then the 3 days after that to return Saturday, COVID negative, 5 negatives, to coach the number 2 Alabama Crimson Tide to victory, 41-24, over number 3 Georgia. I haven't heard of any false positive tests. Heard a lot about false negatives. I haven't heard about any false positives. And it made me wonder, in one of the biggest games of the year for Alabama, what's the chances that he actually really had a false positive versus were they doing something fishy? I'm ER Dr. Larry Burchett, MD. I want to review COVID testing and just ask that honest question. So let's talk about, first of all, let's take a step back. Let's talk about COVID testing. There's 3 kinds of COVID tests, okay? 2 of them, one of them's called the PCR. That's the most common one we use to diagnose COVID. That's what Saban got. It's typically a swab in your nose or the back of your throat. Sometimes they stick it really far back. Last time I had it, they kind of swabbed my throat and they shoved it up my nose, although it wasn't like the brain biopsy that goes all the way back. That's the PCR. PCR is polymerase chain reaction. It refers to how they run it in the lab. And that's the main way that we use to diagnose COVID. The other one that we use to diagnose COVID when somebody actively has an infection is called the antigen test. It can be a little faster, probably not as accurate as the PCR, but the PCR is not perfect. So there are a handful of people who are going to have COVID, and when they're tested, when they're swiped, the test is going to come back negative incorrectly because they and not diagnose them. So they actually have the disease and the test is negative. That's called a false negative. Does that make sense? The test is negative, but it's false. They actually have COVID. Let me read you some statistics. This was kind of crazy when I saw this. This is from a study on the PCR from Wuhan, China, months ago. They had 213 patients that they knew had COVID, were confirmed in COVID. And this is the percentage that came up negative. So of the throat samples where they just kind of tickled the throat, 40% of them were negative and they actually had COVID. Of the nasal ones, 27% were negative when they actually had COVID. And the sputum, where you hock something up, a loogie from kind of in, spit down in your lungs, only 11% of those were negative. So the deeper down into the system that you get, back of the nose or in here, the more accurate the test. But there's a significant amount, as you can see, with the current COVID tests that just are incorrect, who have COVID, but it's falsely negative, which of course is worrisome because somebody comes in, I've had people get tested, they're negative, they want to be able to go live their life and not worry about getting anybody sick. 30% of those people are 30% of the people who have it are going to walk out like that and think they're okay. That's not a very good test. But that's the false negatives. Saban didn't have a false negative. You would be evaluating this for, did he actually have a false positive? That is much less frequent. So the number we use for false negatives, well, maybe up to 30% of these nasal swab PCRs can be false negatives. But the false positive rate is much, much less, somewhere between 1 and 4%, below 4%. So 1 out of 100, maybe 4 out of 100. In other words, 96 or 99 out of 100 that test positive actually do have the presence of coronavirus in these areas. It's a separate issue to figure out if they're actually sick from it, because we have people that are sick that get better, but they continue to test positive later. So what does that false positive mean? In that case, it means that they still have viral particles, but they might be dead viral particles and they're not making them sick anymore. To get back to this, so it's very unlikely to begin with that Nick Saban has a false positive. So of course, Wednesday, they do the right things. He's positive, he goes home to self-isolate. He can't coach the team. He can't be there live running the practices. in the rooms with the coaches. I'm sure he was still doing virtual stuff to prepare for this huge game, right? But he can't actively be there anymore. They were doing the right thing. And so the SEC protocol says that for him to return, he needs 3 negative COVID tests. Why 3? Well, remember, you can have the disease, get the test, and get a negative test 30% of the time. Okay? So 70% of the time it's right. So they swabbed him on Thursday, and they had to be 24 hours apart. So they swab him on Thursday, and it's negative. Well, that's 70%, but there's still too big of a window where it's like, well, shoot, that could be a false negative. He still could be positive. So the next day they swab him again, and to get 2 in a row that are negative, the number goes from 70%, it's probably 70% correct, to it increases into the 90s. To get 3 in a row negative, it's like 98 or 95. So each time that you would get 3 in a row, it becomes smaller and smaller that somebody's actually negative. He had 5. So if they did a good test and shoved that thing in the back of his nose really good, and if all of that, there's integrity to all of that, and let's be honest, people have cheated before. I have no idea if they did it right or not. If they did it right, then him having 5 negative tests, he doesn't have COVID. He doesn't have COVID. Does that make sense? Yeah, they're wrong 30% of the time, but they're not going to be wrong 5 times in a row. And so you come to the conclusion, however unlikely, 4%, 1%, less than 1 or 4%, he had a test that was positive, but he didn't have the disease. So, okay, that's the first thing I wanted to explain. Now, the second thing is what makes this so it's a terrible test. It's not a very good test, but let me add something that makes this a little more difficult, which is the test isn't as good as it needs to be, absolutely needs to be better. Because look, the conclusion is this guy went home not because he was sick and doing the right thing. He went home because our test wasn't very good. The result of that crappy test was he missed out on practice in a big, in a huge game. Like, there was a big consequence. So many people, similarly, we're testing millions of people all over the world. There are going to be a whole bunch of people who are home isolating when they don't need to be as aggressive about all that stuff. So the consequence of having tests that aren't that good matter. Just like on the other side, having 30% of people that have it test negative and think that they're okay, that also has consequences as well. We need better testing. This is just where we're at with this testing right now. Now, as an ER doctor, I've dealt with plenty of people that have these tests, positive and negative. And let me say this. What makes this even more complicated is, look, if Nick Saban got tested Wednesday and he had a fever and body aches and a cough and all these COVID symptoms, and a whole bunch of players that tested positive and coaches tested positive, I don't care what his test would have been, that would have been positive. Even if his test was negative, it's like you've been significantly exposed, you've got symptoms, that's COVID. Regardless of what the test says, you would need to go home and isolate. But that's not what the case was with him. He had no symptoms. And so it puts us, like, as a doctor, it's like, well, what does that mean? What does the test mean when you're positive and you don't have symptoms? The chance that it actually is a meaningful positive goes down. Now, if somebody had a whole bunch of symptoms and a really good exposure and the test is positive, they have COVID, like 9900%. But change that a little bit. Like, if somebody's at home, has no exposures, and has no symptoms and the test is positive, I don't know what to make of that. It's hard to know what to make of that. On the other hand, let's say somebody has, so you can kind of play with these scenarios, right? Let's say somebody has no symptoms, but they were totally exposed from somebody that has it, and that comes back positive, then that's going to be a positive test. Does that make sense? So the problem is he had no symptoms, and to my knowledge, he had no exposures. And so his test, it's hard to know what that thing means. It's hard to know what sense to make of it. Now, in this case, they did the right things. They didn't want to expose anybody. They had to clear all this stuff. I think I would have done the same thing. I wouldn't have been like, oh, it's nothing. You have no symptoms. Like, got to take it seriously, because the one and whatever that he had it, you don't want to give it to everybody else. Again, the test is limited, but we're doing this kind of surveillance to try to catch all of these cases, up to 50% of cases, 40, 60, 50, whatever the number is. Significant amount of COVID cases happen with people that don't have any symptoms. The more we test people who have no symptoms, the more false results we're going to get. That's the nature of testing. So what I'm trying to explain here is, I think a lot of people, you may think, oh, the test is positive, you have the diagnosis, the test is negative, you don't. It's way more complicated than that, because the test isn't that good. And so we have to make sense of it in the context of symptoms and exposure as well. Let me give you an example to make this sense. Strep throat, right? You've got bacteria, streptococcus is actually the name of the bacteria, that starts inflaming up your tonsils and causing a bacterial infection, often with fever, really difficult to swallow, painful throat, lymph nodes can swell. We have a rapid test for that in the emergency department. It can be helpful. But if somebody comes in and they've got a fever and their tonsils are huge and they have pus all over them and they get strep all the time, that person's got strep throat most likely. And I will treat them with antibiotics, because antibiotics will help cure that, as opposed to a virus just causing some sore throat, which antibiotics are not going to help. So but I'm not going to do the test. I don't need to do the test. On the other hand, does that make sense? They've got strep. On the other hand, if somebody came in and they have no symptoms, and they're like, hey, I just want to get a strep test. You swab them, like, what does it mean if it's positive, if their throat doesn't hurt and they don't have a fever? It's like, I don't know what to do with that. Do I treat them with antibiotics just because the test is positive? Maybe the test is positive, but it was an error the way it was run in the lab, or for all the reasons that a test may be positive. I don't know if this explanation is helping at all. So, okay, so it seems to me that Saban had this positive test on Wednesday, and then he gets 5 negative tests, which makes, again, if they did them correctly with integrity, etc., if he really had 5 negative tests, he doesn't have COVID, especially if he has no symptoms and no exposures, which is what we were told. And so the conclusion really is, if all of that is true, he did have a false positive test. Bummer. That sucks. The test needs to get better. That really harmed him, in terms of not being able to practice and prepare as he normally would. But, the chances that he actually would have it with 5 negative tests, it's not zero, but it's very, very, very unlikely. Funny, right? Interesting case. So there you go. One of the biggest games of the season for the Alabama Crimson Tide, and that's what happened. The Georgia game, Wednesday, Saban goes down, gets all these negative tests, shows back up on Saturday, coaches them, they end up coming back and winning. I watched it. It was a great game, actually. I thought Georgia was going to win, but Alabama in the second half really took control of the game and won. So let me see if there's anything else that I wanted to say about this. So there's where we're at right now. Again, there's 3 COVID tests. The PCR is the one that he had. There's the antigen one, which also diagnoses it. And then the other one that I didn't mention is the blood test called serology, where they check for antibodies. And that would mean you had prior infection beforehand. Does that make sense? So that's interesting. So there you go for college football. It looks like Saban had a false positive test. I hope that he stays safe, and everybody in college football does continue to stay safe and to continue to play that game that they love. Thanks for watching. Please reach out. Give me your comments. You can always reach out at Dr. Larry Burchett on social media. Stay safe. Stay sane. I'll see you next time.